Sometimes a small act can change everything. For many women across Africa, it's as simple as a test. No machines, no hospital lines, just a moment of choice. This is the story of how scientists and communities are giving women the power to protect their own health. Meet Melanit, a woman who chose courage, took the self-test, and began her journey to protect her health.
She got the information from Gada Health Center. She go there and they told her about the screening and the HPV kit. So she got screened and they refer her to the hospital.
The African cancer has some unique features which has to be understood and addressed accordingly. Epidemiological, genetic, and socio-dynamics features of cancer in Africa are different from other parts of the world. Cervical cancer is strongly linked to a virus infection called HPV virus.
HPV, the human papilloma virus, is a common virus that most people encounter at some point in their lives. Most infections clear naturally, but some types, called high-risk HPV, can stay in the body and over many years lead to cervical cancer if not detected early.
Africa being a very communitarian setting, and we have our own culture and we have our own traditional way of understanding issues, including diseases and our problems. So how cancer is framed in the communities is unique by its nature. One needs to understand how the patient perceives, how the community perceives the disease. Cancer is associated with stigma and discrimination.
For years, screening meant visiting a clinic, waiting in line, and undergoing uncomfortable tests.
Good morning. So what do you have for today? You have specimens. The VIA, as its name implies, is a screening method which employs visualization of the cervix after pouring acetic acid, 3 to 5% acetic acid onto the cervix. But often this test is a bit invasive, and women, especially women who really feel that they are healthy, don't like it.
In many communities, fear and stigma still surround cancer. But through awareness campaigns and local health workers, more women are finding confidence to step forward and get tested.
Now we are trying to promote a different type of screening called self-sampling, whereby the sample can be taken by the women themselves.
With self-sampling, women can collect their own sample at home or at a nearby clinic and drop it off for testing. It's private, simple, and has helped more women get screened than ever before.
But now it's getting better because people are using the kits, get screened by themselves and know their status.
When testing becomes easier and more comfortable, more women say yes. This means earlier detection, faster treatment, and lives saved.
This is a 10 PrEP solution, but I think we thought for resource-limited countries, this per patient is expensive. So we are just validating another collection solutions using protocol developed in our lab and from collaborating laboratories in Germany. So we are preparing a 50 ml solution, and we are validating against this company produced 10 PrEP solution, so that we will again validate the collection.
Community health workers have become the bridge, visiting families, educating mothers, and breaking down the stigma around cervical cancer.
Most of people didn't have the awareness about this before. It's when they get sick, they came to the health center to seek for treatment and so on. For most of the people in our community, I give them advice by going to home or in the community. And for those we found at the health center, we give them education out there.
The evidence is so strong that countries are now updating their national guidelines, making HPV self-testing a key part of women's health policy.
Now we are going to release a new guideline to prioritize HPV-based screening in the country. But according to the current, which is HPV-based screening is recommended when it's resources available.
From data to policy, from labs to villages, this innovation is shaping the future of cervical cancer prevention in Africa.
Our hope is that once we have the data out and the results out, we hope we'll be able to convince decision makers and policy makers at national and international levels or regional and broader levels to improve the way how we deal with cervical cancer.
What began as an idea is changing lives. More women are getting screened, more families are finding hope, and fewer lives are being lost to preventable diseases. Beyond the science and systems, this self-screening kit has given women dignity and the power to take control of their health in their own hands, in their own time. Because sometimes courage looks like a simple test, and that's where change begins.